Hello and welcome to the Spokane Regional Health District's training on the immunization data system called PrepMod. My name is Audra Marshall. I am the Regional Coordinator for the Childhood Vaccine Program here at SRHD, and I am going to be conducting the training today. So SRHD does employ this application during our immunization clinics for COVID-19 and influenza vaccines. We do hope to open this to additional vaccines in the future, but for now, we will strictly be collecting data for COVID-19 vaccines and influenza vaccines. The reason that we use this application is that it allows us to capture patient demographics without the potential issues of spelling or writing areas that come with paper copies. The additional bonus is also that we use this program because it automatically uploads patient data into the Washington State Immunization Information System, or WAIIS, as we frequently refer to it as. The WAIIS is a statewide database that houses patient immunization records, and it's a really amazing system because patients can actually access it through their lifetime in the event that they lose their own immunization records. It's also beneficial because it eliminates the direct data entry that SRHD did have to do prior to using this system. That being said, this program does house personal health information, or PHI, so all HIPAA laws must be upheld when accessing it. Moving forward for this training, I will be following the SRHD clinic model and basic flow that could deviate slightly for each clinic, but the general pieces will still remain the same. At this point, if you've not viewed the PrepMod training guides for each station in the clinic process, I highly recommend that you pause this training and go back and view them to understand each station prior to the review. They will say registration, consent screening, and our vaccination station, as well as additional information on how to log in. I'm going to begin by logging into PrepMod, since that's something that every person accessing it will have to do. When we receive information that you are either going to be volunteering or staffing an SRHD clinic, we automatically add you as a user by using your email address and your cell phone if we have access to it. When we do that, the PrepMod system generates an email. It looks like it's coming from someone named Vaccination Clinics, and it prompts you to create your password. We really need you to complete this step prior to the beginning of the clinic. The beginning of the clinic is very hectic. We have limited time, and the requirements for your password in the PrepMod system are on the longer side. So I have found in the past that people do struggle with that. So it's really important that you do that prior to the start of the clinic or prior to arrival at the clinic. The other piece is that it's really important that you use a supported browser. These browsers will include Chrome, Firefox, or Safari. Internet Explorer and Microsoft Edge do not support this application. If you use one of those during the clinic, it means that either you won't be able to properly access pieces that are needed to input vaccination data, or that at the end of the clinic, the data won't automatically upload into the IIS, and that person will look as though they haven't been vaccinated through the state information system. So really important we stick to Chrome, Firefox, or Safari. Now, for our clinics, when we do use PrepMod, we have computers available on site. Most of them should already be set up to the PrepMod site using primarily Chrome, or again, one of the other supported browsers. But in the event that you're using your own computer or it hasn't been set up, we will start from the very beginning on entering our URL. We also have laminated copies of this URL that will be at each station, so no need to write it down frantically right now. You will have access to it. So our URL, once we log in, is going to be PrepMod, prepmod.doh.wa.gov/users, plural users, /sign_in. For the purpose of this training, I'm using a training interface that will not contain PHI. As you can see here, my screen is going to look a little bit different than the live site. It'll maintain this pink bar up at the top that says this is a test site, and then my URL is using one that says test at the beginning. So as everyone needs to, we are going to log in here. Because I'm using a test site, it will not require the standard multi-factor authentication piece, or MFA. The MFA will pop up at this point in our standard site, and it will require that a code is sent either to your email address or to the cell phone number that's listed under your user profile. You will need to be able to access either or at the clinic. So make sure you either bring your phone or make sure that you know your personal email address so you can access it on the computer that you are utilizing for the clinic. Because again, every time you log in, that MFA will be required due to HIPAA laws and the need to protect our health information. So once you've logged in, you can see this screen. It does have tiles. Now, you may not have all of these tiles just depending on the user status that you have, but you will at least have these two primary here of Start Clinic Standard and Manage Clinics and Users. You are primarily going to live in Start Clinic Standard. Once you've gone through the login process and navigated to the screen that you need to stay at, you won't have to do this again. So I'm going to click Start Clinic Standard here. And as you can see, we have a list of clinics. Some are in the past. I actually think all of them are in the past on this training module. The ones that you will be seeing are either that day or in the future. Each clinic has its own unique clinic ID. It has a venue location. Now, venue locations often overlap each other. So really, the clinic ID is the only piece of information that is specific to each clinic. And we have our access, whether or not it was using a private link or a public link, meaning anybody can access it without the specific link to the clinic, how many people are registered, and then we have a list of activities and options for that specific clinic. Now, you can either just determine which clinic you're accessing based on your venue location and date and if there are people registered or not, or if you're really just not sure and the lead staff on site isn't available in that moment, you can always navigate over here and click View Edit Clinic. And this will take us to a screen that gives the overarching information on that clinic itself, such as an address, date and time, who your lead staff members are on site, and your vaccinators. So these are just bits of information that are individual and unique to each clinic. So that may help you determine which one is the one that you need to be in, again, in the event that your lead staff on site is unavailable. I'm going to navigate back out to that main clinic page. All my clinics disappeared because it defaults to searching for upcoming when that happens. Since the clinic we're going to be using for the sake of training is in the past, I'm just going to do all and hit search. So I had determined that this clinic on March 4th is the one that I need to be accessing. I'm going to go over and click on the Clinic Activity button. This is where every single station will live for the entirety of the clinic. So that is how you are going to get there and where you are going to stay, regardless of what place you are or what station you're manning in the clinic process. Just to review what we're seeing on this page here, up at the top, we have our venue that is community located. We have the date, we have the time. We have our lead staff here, John Smith. How many patients are registered? That could be 0 if we're doing a walk-up clinic. And here we have our vaccines available at this clinic. Now, again, we're doing COVID and influenza, and we carry every COVID vaccine, and we also carry different formulations for influenza. So that may be a large number of different vaccines, but it's a nice overview on what we are offering. So things like flu mist, for et cetera, more of those specialty requests. So it's a nice place to be for our registration folks who are seeing people first, and they can see how many doses we brought, how many doses have been administered, and how many doses are remaining. Now, keep in mind, as you go through each station, it may take some time for these numbers to update. So if you're registering and you can see that there are only 2 or 3 remaining doses, you really want to verify that somebody who's requesting that same dose isn't, for example, waiting to be called up by the vaccinator, because they will then maybe use up those doses future patients, and so you can't have the patient that's in front of you have that option. So just as a little reminder that takes some time for this to update as the clinic process moves on. We're going to scroll down here. We can see this blue save button. A lot of people have it drilled into their heads to save their work as they go. That is absolutely okay. You can click the save button as many times as you want, or you don't have to click it at all. It's really up to you and your comfort level with that save as you go. This purple one that says save and submit, you will not need. No one will need it. It is only something that our lead staff or either an SRHD staff member will be handling. When we click the save and submit button, what it does is closes the clinic for any additional information, meaning we can't add patients and we cannot vaccinate patients that are already added. It then takes that data and it moves it over into the IIS that I referenced earlier. So we really don't want to touch that. I don't want anyone to panic either, though, because if you were to accidentally click on it, you'll either get one of two error messages. This one is saying you need to double check because there's patients that are registered that don't have an activity recorded for them. So this is a nice feature in the event that somebody got to talking and they forgot to actually mark that the patient in front of them was vaccinated. The other error message it might bring up that says, are you sure you want to close this clinic for additional data? So even in the event that you accidentally click that button, you still have this little fail-safe in place. So I'm going to click cancel. Here is our search bar for our patients. Now, there have been clinics where we have had over 1,000 people, so this comes in handy. You can either search by first name or last name, but not by both. So it does get a little finicky. Say it is a common name, and in the event that, or excuse me, for the sake of training, we've used a lot of people with the name test in their first name or last name. So we'll say that's our common name. I can then search by appointment time if they made appointments, or date of birth, or their patient name. So then it can alphabetize that. It's just in the event it's a common name and you see a lot. Our clinics have been relatively smaller compared to how they were in the very beginning of the pandemic, so you really shouldn't have this issue, but it's there if needed. So down here is where we will see what patients have been vaccinated, if they've refused, sick, or been absent or withdrawn. You can also add remarks to a patient once they have had an activity recorded for them. And that could be something like syncope, anaphylaxis, whatever you think is appropriate. The ones that don't have an activity recorded for them, you are unable to remark. So that concludes our logging in and navigating to the screen where you will live for the entirety of the process moving forward. I'm going to go ahead and start on our registration process. So this will be step 1 in our clinic. Again, if you are operating in a condensed clinic, it may be registration and health screening, but for the sake of matching up with our training manuals, I'm going to just stick to registration. In order to do that, you're going to go ahead and navigate again back to your clinic activity screen where we already are, and you're going to click on Add More Patients. As you can see, it's opened up a new window. I really want to point that out because when you're done with registering a patient, this screen that you're on will dead end. It will not take you back to the clinic. All you have to do is click Exit, and it takes you right back to your original window here. So we're going to go to Add More Patients. This clinic is set up for appointments. Our walk-in clinics will not have this. It will go straight to personal information. As you can see at the top, it has step-by-step where we're going and what our next screen will be. Right now we're on appointment. Again, this may not be an option if we're doing walk-ups only. You'll just pull up immediately that personal information screen. If you have a walk-up patient, you're going to click on any time. It really doesn't matter, any available time. It's really hard for us to stick to specific appointment times. We use them just typically to regulate flow. So since you have a walk-up, they're right in front of you, click any available time. I do want to point out for our patients that pre-register and they do it on their cell phone, because that's a common practice, as we all know, doing things just strictly from our mobile phones. It's really difficult for them to see this scroll bar here. So in the event that that's happening and all of these morning appointments or first appointments are taken and grayed out, they may become confused saying, you guys didn't have any available appointments. Well, what they actually need to do is click into this box with their finger and then scroll upwards using their finger. I can't demonstrate it on the computer because obviously we only use the scroll bar here, but it is important to note if somebody mentions it to you, just for their second dose, if we're having appointments, pre-registration for second dose clinics, it's just helpful for them to know in the future. We do like to encourage people to pre-register because it does save a lot of time on the front end and for staff members. So I've chosen my appointment time. You can see here they're going to hold it for 25 minutes, which is helpful in case you have someone who's struggling with the information as we go along. We're going to click save and continue, and it takes me to personal information. As you can see, it is saying we're only offering Moderna and then our age range, which means if your patient is under 18 years old, they are not eligible to receive Moderna vaccine. That being said, most of the time we have all three vaccines available for COVID. We will have Moderna, Pfizer, and J&J available. So we can always adjust as needed. You can also see that there are required pieces of information on this screen. They will have this little red asterisk on them. There are areas that don't have it. We do really want to make sure that all the information we are obtaining is as accurate and thorough as possible, because what happens at the end of this clinic when PrepMod does the interface with the IIS, it searches for any current profiles. So for example, if you have a patient in front of you that says, my name is Bill, you may want to verify with them that they don't go by William on their health documents or health records, because the system will search and search for somebody named Bill, and William may already have a profile in there and it's not going to recognize it. It's going to say, oh, there is no Bill. I'm going to create a brand new profile. So then that means that patient will have two separate profiles. And in the event that they want to obtain their immunization information, that's going to cause the person who's searching for it to have a little more grief and not be 100% certain that it's the right person. So we just want to be as thorough as possible. So for the practice one here, we're just going to make up a person as we go. You can see race, ethnicity, occupation are all required components. The patient can choose other, they can choose refuse, whatever they are comfortable with identifying as. We do encourage them, though, to choose at least something on race, ethnicity, and occupation. The reason being that the SRHD is committed to reducing access barriers. We want to increase access, and we want to make sure that we are equitably distributing this vital health tool of immunization. So we do that by reviewing exactly how many, what our percentage is. And so we really rely on this data to make sure that we are being as equitable as possible. So we're going to go ahead and make up just any old date of birth here from 82. Gender, again, you have the option male, female, other unknown, whatever that patient is comfortable with. You can see here that the email address is required. Now, a lot of times for our clinics, and just depending on what one you volunteered for, we do access and provide access to some of our disproportionately impacted groups. That includes some of our homeless shelters, those living houseless, and that the reality for some of those groups is that they may not have access to a reliable email address. If they do not, or if there's someone who, and I don't blame anyone for this either, just doesn't want to have any kind of electronic footprint, then what you will do is just touch base with your lead on site, and they can give you an SRHD facing email address, just because, again, it's a required component. So we don't want to just make one up. We can actually do an SRHD email address that we can then properly house, that has all of those PHI and restrictions in place so that it's safe. So we're going to go ahead, and I'm going to use SRHD's address here just for the sake of the training. And in the past, when we had limited access to vaccines, it actually would stop you at this point if the person was from out of state. That's no longer an issue, though. Oh, so I didn't select an occupation. As you can see, when I went to save and continue, it said, wait a minute, you forgot this required piece. I'm going to go ahead and hit student. As we move forward, we're probably going to see some younger age groups. So that will be probably the one that you use the most. But in the event that they are uncertain or kind of in between, you can always do other if the job isn't on that drop-down menu. So save and continue. And it brought us to step number 3, health insurance. So it does have this message that the vaccine is provided at no cost by the government, but your insurance will be charged for the cost of administration. That is standard for most healthcare facilities. Because we are providing access to disproportionately impacted groups, SRHD does not bill for insurance. We must collect the insurance type. So private insurance, medical, Medicaid, Medicare, no insurance, whatever that looks like, we need to choose that, and you won't be able to move on without choosing one of those options. But the rest of this, as you can see, is grayed out. We don't house their insurance card information. We don't take it. We just stick to the type. We're going to hit save and continue. It's going to take us on to our health questions or screening sheet. Now, to note on here, as I said before, we're sticking to the outline station. So this station right now is the registration piece. So if you are strictly doing registering, you are not doing any kind of health screening, that's its own station, then I don't want you to worry about how the patient answers these questions. That will be reviewed at the health screening station. In the event that we've condensed it and you're doing registering and screening, this is where you're going to want to pay attention to the way that they answer, ask those probing questions, and determine if this is the right setting for them to receive their vaccine. We also review our contraindications in our just-in-time trainings at the time of the clinic, and then you will also receive an email prior to the clinic with our standing orders, just-in-time training, et cetera, for that. So hopefully you feel relatively confident by the time you get there, but there will always be a lead on site to answer any questions. So here we've linked to the Janssen EUA, the Pfizer EUA, and the Moderna EUA. Because this is a test site, they haven't updated it with the approved Pfizer Viz. So yours will look a little different. Again, you have to complete everything with the little asterisks. So I wanted to point out, if this is their second dose, it will actually give you the option, it pops up as you click that, to choose what their previous vaccine brand was. Now you can, as I think a lot of people know, we are allowed to mix on the booster and third dose if we don't have any options. But the reality for most of our clinics at SRHD is that we will have all three formulations with us. We will have Moderna, Pfizer, and J&J. Or Comirnaty, as it's, I believe, referred to now with the Pfizer for the licensed version. So we're just going to say, I don't know. And again, for the sake of training, I'm just registering. I'm not caring what they're answering. I'm just asking and choosing the correct answer. There will be additional screening questions if we're also doing influenza vaccine that relate specifically to influenza, things like if they need an egg-free formulation. So it will look a little bit different when you're doing this. At the bottom, it discusses our minimum intervals. It is, as you can see, not updated to reflect any booster or third doses. Your live site will be. At this point, you can either add a child or dependent. This is a handy function because you won't have to re-enter a lot of the demographic information. You can go back or save and continue. For the sake of training, we're going to save and continue. This is going to take us to our consent for services screen. You will have the option of whatever vaccines are available. You choose which one they're consenting. And then we're going to go down and they can either sign their name using the computer here, or they can type their name using the computer. In the event that you do not want to share your computer, which is valid, I know it's difficult to feel like we're appropriately wiping down electronics, you can actually have them consent that you can type their name for them. So for example, if tester says, yes, Audra, I'm happy that you are providing and typing consent for me, I'm going to go down here to this relationship to patient screen, and I'm going to click other and use my name. This is just so that we are accurately keeping our records and making sure that we are transparent as possible. So we're going to then, as you can see here, it also defaults to today's date. You won't have to mess with that. Save and continue. Our next screen is a review screen. That's when you can flip the computer on, make sure all this looks accurate. Again, we are really striving for accuracy so that new profiles are not created in the IIS. Scrolling down here, you can see that there's extra little pieces depending on what they answered. Again, if this is just registration, don't worry too much about it. Just check for accuracy, save and continue. And you are done. That person is registered. You will not receive this error message on you cannot perform this action. This is just because I'm in a test site. As I referenced earlier, you're at a dead end here. You're not able from this screen to get back to your clinic. Even if you do something like find a clinic, it's taking you to the registration page for all PrepMod clinics. So as you recall from the beginning, all you do is exit out and it takes you back to your clinic activity. As you can see, tester is not on here. So we're going to go ahead and hit refresh. And there's tester. 515 of 82. And that will conclude our registration portion. You can then move on to your next patient, click add more patients, and move forward. At this point, we're going to go ahead and review our screening portion. So if you are acting as a medical screener and that's your only station, again, I'm going to keep reiterating this over and over again. We often condense each station. So screening could actually even occur at the vaccination point. For the sake of training, we are treating them as different stations though. So for screening, we're already at our clinic activity. As I said before, we've navigated to this page because this is where everybody is living in PrepMod. You can search for your patient if we have, say, several pages or it's a common name, again, first name or last name, but not both. We locate tester, and we're going to verify the date of birth with them just to make sure that's correct and you are speaking to the right person. We are then going to hover over this question mark. When we do that, a blue screen pops up and gives us all of their consent questions. This is where we're going to ask the probing questions. We're going to check for contraindications, determine how long their wait time is going to be, either 15 or 30 minutes. And then we're going to just make sure that everything is accurate, first name, last name, date of birth before they go and get the vaccine. Once you've confirmed that all this is good, all you're going to do is stop hovering and move on to the next patient. You do not need to check anything. You do not need to notate anything. All you're doing is hovering, screening, and moving on to the next patient. So pretty easy. I did want to point out, as you can see, some of these names are in bold and some are not. The ones that are in bold, it means they answered yes to one of their health screening questions. So it also acts as a reminder when you're screening to say, I really need to check this person's answers because it means that they've answered yes to something. So for example, this patient answered yes to a chronic health condition. This helps us with either screening for that contraindication or just saying, for example, smoking is not a contraindication to receive the COVID vaccine, but pregnancy, if someone is pregnant, then we might say, please make sure that you're having a conversation prior with your OBGYN. While we all know that the CDC and FDA has a very strong recommendation for pregnant individuals to receive vaccine, it's just important because we are not their healthcare provider to make sure they're at least having those important conversations with the people that are oversight for their own healthcare. And that will conclude our clinic screening, or excuse me, our health screening portion of the clinic. We're going to now move on to the vaccination station. So you may be operating either in a scribe capacity, meaning you're not vaccinating, you're only denoting which person is vaccinated, or you could be doing both. You could be acting as your own scribe and the vaccinator. We're going to do the same process, which is searching for the patient by the first name or last name. Again, we're already on our clinic activity screen. And once we locate them, for the sake of this training, we're using tester. You are going to have them verbally verify first name, last name, and date of birth. You are not, please don't read it out to them. You're going to say, tell me your date of birth. We want to make sure we're being as accurate as possible. Once we have chosen the correct person, which is this tester, and they're ready to be vaccinated, we are going to click into this little circle. It pulls up every vaccine that we have available at the clinic through PrepMod, which will be all the COVID vaccines and all the influenza vaccines potentially. As you can see, it's a small kind of funky box that makes everything all long and skinny. And unfortunately, it gets a little more convoluted the more vaccines, but you can at least see that your checkbox is just about dead center with the rest of the items. So even though there may be more vaccines and it may look a little confusing, really all you're looking for is the lot number and making sure that you're verifying that lot number. So we have Moderna. I know that they're getting this lot number, and so I'm going to check that box. The other thing to note, we try as hard as we can to not mix lot numbers with the same brand of vaccine. So we really, you probably won't ever see two lot numbers, for example, for Moderna. That may happen if needed, but we try really hard not to do that, just because, again, we don't want it to be overly complicated. You can see here that it's going to default to IM. That's really where we're going to live. We won't choose anything else outside of nasal. So we do have flu mist available at some of our clinics. So really you're just operating in IM or nasal capacity. It defaults to left thigh. For the most part, we're doing our deltoid or arm, you can choose either left, right, arm, or deltoid. It doesn't matter what nomenclature you're using, arm, deltoid. And then again, you could be using nose if we're doing flu mist. For our reaction, it defaults to nothing. You don't have to put anything in here. It's not required to do that. You could choose none if you wanted to. Otherwise, there's local syncope, anaphylaxis, or seizure. This is something that happens while that patient is still sitting in front of you after you've administered the vaccine, not after they've gotten up and walked away, right then and there. It's going to default to the day of the clinic as the vaccination date. So you can see this is March 4th. And then our volume administered is kind of a finicky one. It has these little arrows, so everybody's tempted to use them, but it will only do whole numbers. So for the most part, we operate in the 0.5, 0.3, 0.2 for our flu mist. So we're going to need to type it in. So we're going to do 0.5. And unit of measure, you could choose either ml or cc. Either one is appropriate, and either one will track the record accordingly. For our general reaction, it's going to default again to none, but this is when that patient walks away. If they end up having, syncope, they faint, anaphylaxis, anything like that, you can note it in here. Otherwise, we typically live in the none. Vaccinators will be preloaded. So this one has John Smith vaccinating. If you don't see your vaccinator that you're scribing for or your preceptor, please let lead staff know. That means that it wasn't added when we created the clinic. So we will need to go in and add that. Does this vaccination complete the series? So this one's going to be tricky because we all know that recommendations are constantly changing. So things like booster doses, things like third doses, really what I want you to stick to is, does it complete the original series recommendation? So for our J&J, that would be 1, Moderna 2, Pfizer 2. So if it does, yes. If it doesn't, no. I am going to tell you it's okay to choose whichever one that you would like to the best of your ability, because it won't impact their record in the IIS. So even if this was dose number 2 for Pfizer, but you accidentally click no, it'll still show 2 doses in the IIS. We're going to hit update. It saves it. And it'll pop us back into our clinic activity view where we'll look at tester. And as you can see, the circle is blued out here. That means that the event has been recorded. You can see it also opens up their profile for remark in the event that we need to. So that will conclude our vaccination process, and that's the entirety of the PrepMod process from registering to documenting vaccine administration. I'm going to reiterate too, we provide laminated copies of each of these steps at most clinics, but you can also print them yourselves off of the email you will receive prior to attending the clinic. It is incredibly important that you create your login and know these basic steps prior to the clinic. Now, you may need some refreshers once you get in here, but what we are asking is that you understand at least how to get to the clinic activity. Things can be really hectic, and the lead on site may not have the time or ability to walk you through each of these steps. So it's good to have a general idea. We always have someone to help, if and when they're needed, but it is just, if you've ever been to a clinic, there's a lot happening in that beginning process until we start really get going. So we really want our staff and volunteers to feel comfortable with the system prior to arrival. If you do have any questions around this application or the process, please reach out to the person who sent this video and materials to you. We're really happy to answer any questions and assist with whatever is needed. And as always, thank you all so much for your willingness to help your community. And please stay safe out there.